An elderly woman sleeps peacefully in her home when an intruder forces entry in the dead of night, turning a place of safety into a scene of unimaginable brutality. What drives someone to cross that line and unleash such extreme violence on a vulnerable stranger? This is Stephen Allen Thomas, convicted in 2014 of the 1980 capital murder of 73-year-old Mildred McKinney in her Williamson County, Texas home. Thomas, who had previously serviced her residence as a pest control technician for his brother's company, allegedly returned under the cover of darkness, committed burglary and sexual assault, beat her severely, and strangled her to death. The case went cold for over 3 decades until advances in DNA technology linked him through evidence left at the scene. He was sentenced to death, and the conviction and sentence were affirmed on appeal in 2018. As a licensed professional counselor since 2007, I still see clients full-time every day, Monday through Friday, because apparently I can't help but keep showing up for the long haul. That real-world clinical experiences shapes how I approach these cases on the clinical file. Everything discussed here is purely my speculations based on publicly reported behavioral patterns and evidence. It's never a formal diagnosis of anyone involved. No sensationalism, no judgment, just careful exploration of the psychological threads and potential warning signs that can emerge in hindsight. Another case, another clinical file. Most recent status confirms the Texas Court of Criminal Appeals upheld Thomas's death sentence in 2018, with no subsequent developments altering the outcome. The crime occurred in the early morning hours of November 4, 1980, when McKinley was alone and asleep. The perpetrator entered through a sliding door, ransacked the home for valuables like jewelry and silver items, bound McKinney with multiple ligatures, including a telephone cord, pillowcase, pantyhose, and a sticky ribbon, subjected her to severe psychological beating that left blood splatter and bruising, and assaulted her with an object roughly the size of the shape of a baseball bat while she was still alive, and ultimately strangled her manually, causing her to die. One of the most striking psychological elements is the extreme level of instrumental and sadistic violence directed at a frail elderly victim with no apparent personal connection or conflict. This kind of home invasion often reflects deep-seated issues with power, control, and sexual sadism, where the offender derives gratification from dominating and humiliating a completely vulnerable target. Thomas's prior access to the home as a pest control technician provided intimate knowledge of the layout and the victim's routine, suggesting premeditation fueled by opportunity and a calculated choice of someone perceived as easy to overpower. The brutality, binding the victim while inflicting repeated blows and using an object for assault before the strangulation, points to a profound need for dominance that escalates far beyond theft. In such offenses, the motive frequently intertwines with financial gain with sexual compulsion, where the burglary serves as a pretext for enacting fantasies of total control. The assault occurring while the victim was alive and restrained indicates sadistic elements, where prolonging suffering heightens the offender's arousal and sense of power. This pattern echoes cases like certain serial sexual homicides where offenders targeted isolated elderly victims for their perceived helplessness, as seen in some documented rapist-killer scenarios from the era. The overkill, severe beating, multiple binding methods, object assault causing deep internal injuries, suggests rage displaced onto the victim, possibly rooted in a broader issues of entitlement or resentment toward authority figures or vulnerability itself. As someone who spends far too much time thinking about these patterns, even I found the escalation from professional service provider, a pest control technician, to nighttime predator unsettling. It serves as a reminder that overconfidence in one's ability to compartmentalize dark impulses can sometimes allow them to fester undetected. The decision to leave behind such distinctive evidence, a fingerprint on a displaced alarm clock moved during the struggle, His DNA, you know what I mean, on one of the ligatures reflects an impressive level of optimism regarding forensic avoidance for the time. Events unfolded in a sequence one might charitably describe as less than ideal for long-term evasion, yet the case remained unsolved until DNA advancements decades later. Offenders in these scenarios sometimes demonstrate remarkable creativity in rationalizing their action post-offense, but the physical evidence here left little room for ambiguity once technology caught up. This mismatch between perceived cleverness and actual detectability often predicts eventual forensic accountability. A key psychological angle involves potential antisocial patterns combined with sexual deviance, where thrill-seeking through a home invasion merges with opportunistic violence. Thomas's history included drug use, marijuana, cocaine, and prescription pills, theft from clients' homes during service calls, pretty convenient, and documented violence towards partners, belittling, bruising, and choking threats. These behaviors suggest poor impulse control and a pattern of exploiting positions of trust for personal gain, escalating to lethal force when resistance or vulnerability triggered an aggressive response. His DNA left at the scene during the assault was inferred from the DNA testing on the binding. It indicates the crime was not purely instrumental, but involved arousal tied to the dominance and terror inflicted. This can link to paraphilic interest, while power over a helpless victim becomes the primary driver, overriding empathy or fear of consequences. If walking through these behavioral patterns gave you new insight into how access, opportunity, and unchecked deviance can culminate in extreme violence, I love to keep bringing you these breakdowns. Subscribe if you want the next one to land in your feed. That way you'll always have the psychological context ready when the next big case breaks. It's completely free and it has no therapy bill. The choice of an elderly sleeping victim underscores targeting perceived weakness, common in offenders who avoid confrontation with equals and instead seek total submission. Binding with household items while assaulting suggests he improvised, driven by immediate compulsion rather than elaborate planning. Yet the persistence, despite the victim's struggle, points to a rigid focus on completing the act. Comparable scenarios appear in cold cases of sexual homicide solved later by DNA, where perpetrators with prior non-lethal offenses like theft or assault escalate when an opportunity aligns with internal pressures. The why often traces to accumulative entitlement, substance influence lowering inhibitions, and a core need to assert control through violation. Thomas's post-arrest denials and attempts to shift the blame, as reported in jailhouse statements, reflect minimalization and externalization, classic defenses when confronted with overwhelming evidence. Advancing through the crime despite clear risk of detection illustrates impaired judgment under arousal, where immediate gratification eclipses long-term consequences. These threads, power-seeking through domination, sexual sadism intertwined with theft, history of exploitative and violent behavior, frame a profile of decomposition where opportunity met unchecked deviance, resulting in catastrophic harm to an innocent person. Here are the key mental health terms that I reference throughout this video, with brief definitions. Sexual sadism, deriving sexual arousal from inflicting pain, suffering, or humiliation on another person, can escalate to lethal violence when combined with other factors. Impulse control, the capacity to resist urges and consider long-term consequences. Deficits allow opportunistic crimes to turn deadly. Power and control motives, a drive to dominate others, often compensating for perceived personal inadequacies, common in sexual homicides targeting vulnerable victims. Displaced aggression, redirecting anger or frustration onto a substitute target. Here, possibly from broader life stressors onto an accessible, helpless individual. Minimalization, a defense mechanism where the offender downplays the severity of their actions or externalizes blame to reduce internal conflict. In so many levels, this case is very alarming and jarring and disgusting, outright disgusting. It is so hard to imagine. I mean, think about it. Can you think about your grandmother or your mother this happening to? somebody that she trusted. She had a bug issue. She called a pest control agency. They sent somebody, and that person killed her and did these horrible things to her. That goes to show that we need to be very careful. If you call somebody to come to your home, you should probably have another person there with you. So what did you think about the Stephen Allen Thomas case? Were there any of the mental health patterns or psychological dynamics that stuck out to you? And that closes another clinical file. Until next time, keep looking a little deeper, stay curious, and stay safe. If you get yourself spotting patterns everywhere, welcome to my daily life.